How is cytology used in a colon biopsy explanation? Imagine you're having a colonoscopy and a suspicious area catches the doctors. To find out if it's something serious like cancer, a tiny piece of tissue is taken from that spot. This tissue is then examined carefully in the lab. Now, while most of the time the lab looks at the whole tissue structure to see how the cells are organized, cytology offers a different look. It focuses on the individual cells or small groups of cells taken from the tissue. In a colon biopsy, after the tissue is collected, it is preserved in a special solution to keep it intact. The sample is then sliced into very thin sections and placed on slides for examination. This process is called histology and helps doctors see the overall architecture of the tissue. But sometimes, small amounts of cells are scraped off or collected from fluid in the colon. These cells are spread onto glass slides, stained with dyes that make cellular features stand out, and then examined under a microscope. This is where cytology comes into play. The cytology process involves looking for abnormal cell shapes, sizes, or arrangements that could suggest precancerous changes or cancer itself. Cytotechnologists and pathologists are trained to spot these cellular clues. Sometimes, they perform a quick check right in the clinic, called rapid on-site evaluation, to see if the sample looks adequate or if more testing is needed. Cytology is especially useful for catching early cellular changes that might not yet from a visible tumor. It helps distinguish benign from malignant lesions when combined with tissue analysis. It can also be helpful when only a small amount of tissue is available or when fluid samples from the colon are collected. Overall, cytology adds a detailed cellular perspective to the diagnosis process, complementing the tissue structure analysis. While the final diagnosis usually depends on examining the tissue as a whole, cytology provides important additional information to guide accurate diagnosis and staging. This approach is part of standard medical practice for diagnosing colon cancer. It ensures that doctors can detect abnormalities early and plan the best treatment options. Remember, always consult healthcare professionals for personalized advice, as each case can be different. Cytology is a valuable tool that helps improve the accuracy of colon cancer detection, making sure patients get the right care at the right time.